guys. So today we are doing Wow Fusion for hair restoration. Let me just get started. So we've had, this is Neil, say hi Neil.
Hello.
He's had this before. He's had some numbing cream on his head for the last sort of 30-40 minutes. We have restarted this, having done a course of treatment. I don't think we've done, it's nearly 2 years since we've done a treatment. So I think it was January 2020 the last time we did a treatment. And we've been treating for about 6 months and had a really, really good result. So I'm just cleaning off all this numbing cream now, because he's not allowed to wash his hair for the next couple of days. So we need to make sure it's nice and clean before we start. So what we did a full course of treatment from home when we were in lockdown, because we had nothing better to do. And what had happened, Neil had started to go quite thin on the top here, and there was a very definite kind of horseshoe line here. It had come right back on the sides. Now, if you just turn your head, I don't know if you can see, I might bring the camera across. Now, what you can see is that there is some thinness here, but this was almost completely smooth across here. There were very few hairs in this patch, so the result we got was really good. And the top of Neil's head here was very thin as well, and this is much, much thicker than it was when we started kind of 2.5, 3 years ago. So although, you know, I mean, this isn't magic, and we probably should have kept it out more regularly, actually, we got to the point, because I'd started cutting Neil's hair. Those of you who don't know, Neil is my husband, which is why I'm sort of talking quite familiarly about him. And we'd started cutting his hair shorter and shorter and shorter, going, yeah, it's got to go, you know, it's too short, it's too thin now. But now we've got to the point where we're able to, it's not anywhere near as thin as it was, and we're able to leave it longer, and it actually looks like he's got some hair again. So what we've decided to do is to restart the process, having had the gap that we've had, and do it properly, get the timings right over the next few months, and see if we can't push that result along a little bit further. One of the things we noticed when we did this the first time was how much quicker his hair grows now. So we would cut his hair probably, what, once every 3 weeks? We're having to do it about every 10 days now, aren't we? Would you agree? About every 10 days? And so that has been something that's changed and carried on since we did this like 2 or 3 years ago. So it has made an astonishing difference to the fact that we would probably be shaving sort of, you know, to a 1 now and making it, you know, sort of almost kind of, you know, shaved to the head, which we just haven't needed to do. So I'm quite excited to see what happens doing this again and seeing how much further forward we can push this. So we've taken some pictures. What I'm doing now obviously is cleaning the scalp and the hair. It's quite an intensive process for hair restoration. This isn't just a one treatment here and there. I might have overdone the cleaning stuff. We've got a bit bubbly, bear with me. So it is quite intensive, and the people that do come on this journey with me, you have to be committed, because initially, now I think we're going to slow this down slightly because we've done a course before, but an initial course, you would be seeing me weekly for the first 6 weeks, and we would be doing this weekly. And then you drop down to monthly for 3 months, and then your maintenance, well, you move on to 3 monthly, and then maintenance, I would say probably, depends on the person, but you would be doing this probably 6 monthly to 12 monthly to keep the result, depending on the person and how that goes. My phone's just moved, I think it might be about to collapse. If we suddenly disappear, I'll put it back together. So, and the way that it works, you'll see the Wow Fusion device in a minute. This can be a little bit uncomfortable as well, hence why it's had the numbing cream on for quite a while. Normally, the first treatment that you have with the Wow Fusion for hair restoration, you would actually put botulinum toxin in the first treatment. That makes it a medical treatment. We're going to have to do it on the second one because I haven't got any for him at the minute. but we will be using that, and that really helps stimulate the hair growth. So what I'm doing now, I'm prepping the skin with a clinical skin prep solution. So we're all ready to go. I've already drawn up the Wow Fusion device, and those of you that have had Wow Fusion with me will know what it feels like. We're actually using the 1mm device. So we've got a 1mm and a 0.6mm device. For normal anti-aging and skin treatment, I would use the 0.6, but with this one, we're using the 0.1. Sorry, the 1mm, because you need to get down a little bit deeper into those hair follicles. So what we do, this, for those of you who haven't seen one, this is a Wow Fusion device. Okay, so this is a microneedling device that has gold-plated needles. If you can see, are they too? You can just about see there, I think. You can see those little tiny needles in the end of that device. And this is a cocktail of mesotherapy, including the very specific hair product. And it's got a vitamin complex, and it also has hyaluronic acid. Now I need to just get this flowing without dropping it. Are you ready now?
I'm ready.
As I said, this can be a bit uncomfortable, and the other thing it might do is make him sneeze. It's really common when doing Wow Fusion, particularly on the sort of forehead and around the nose and on the scalp, to make people sneeze. So we're going to start around here, and all we're doing is these needles push back into the device, and it delivers a tiny little bit of the mesotherapy into the skin, down into the needle points. Now, I have to remember where I've been, and there should be enough to cover the area that we need to cover. If anybody's got any questions, by the way, pop them underneath the video and I will come back and answer them later, because also I can't scroll through. How are you feeling? Is that okay?
Okay.
Can you feel it?
I can feel it.
Painful?
It's tolerable.
Hopefully the numbing cream has just taken the edge off. Warn me if you're going to sneeze. So who does this work on? Bear in mind, this isn't just for guys, this is for women as well. Quite often when we get sort of menopausal, hormonal changes, or people who just have thin hair naturally, if we have hair that starts thinning, you can use this to help stimulate hair growth. It wouldn't work on somebody who was completely shiny bald. You have to have some...
I'm building up to a sneeze. But...
You're building up to a sneeze. Okay, let me know if you need me to stop. Yeah, do you need a fall?
I'm okay.
You're right.
There's one there.
It is funny how this makes people sneeze. So you have to have some active hair follicles. Told you. So yeah, you have to have active hair follicles for this to work, and it rejuvenates, it stimulates the hair growth, and the hair becomes thicker and dense. I know a friend of mine, some of you might know Michelle Worthington. She did it and had an amazing result on this lady. The hair came back a slightly different colour, it came back grey, but she could dye that, and she had much thicker hair afterwards.
Mine came back grey too.
Yours was already grey. If anything, I think you've got more darker stuff around the edges now, which is interesting. But this is a process, and like I said, we're still seeing the results 2-3 years down the line. I think we did some microneedling, some skin pen on your scalp as well, didn't we, a few years ago?
I think so.
But we didn't have the mesotherapy for that, so I think the results weren't as good. This really, really helps. The other things we're going to do with this over the next few months as well, all of the, because I only do hair restoration as a subscription package because you have to stick with it, so you pay the first bit up as a chunk and then you pay the rest monthly for 12 months, and that package includes all the supplements you need to get the best results. So it's LED, you have LED treatments as well. Normally we'd do the LED before the treatment. You know? and biotin hair supplements. It includes the medical grade ones. So the medical grade ones I talked about at the beginning, where you add, so what you'd know is Botox into it. That is done every 3 months. So it would normally be done at the first one and then 3 monthly moving forwards. And so it includes all of your appointments, all of your LEDs, all of the supplementation that you need to go with it for the course of that first 12 months. And then maintenance ones are usually just done on a pay-as-you-go basis. Obviously, we take photographs. You're assessed before you commit to it because it is quite a big package. It is available on my website as well. If you go to the subscriptions page on my website, it gives you the breakdown of the cost. And actually, costs will be going up next year, so now would be a good time to commit to that because all subscription packages are protected from any price increases. Is it gone?
Sorry.
It's all right. So it is a big package, but the difference it can make to people is huge. Like I said, we were almost at the point where we were going to just start shaving it, to a grade 1 all over, and we just don't need to do that now. You right?
Yeah.
Is that a bit sore now, or are you wait to sneeze?
Yeah, a bit of both.
A bit of both. So yeah, it's a bit ouchy, but it doesn't take very long. I don't know how long we've been going for, 10 minutes. And basically all we do is make sure that all of this, so we've got about that much left. I don't know if you saw it at the beginning. We've got about third quarter left from what we had before. And I kind of go across routinely, so the whole scalp gets the same amount. And then on the thinner bits, so things like here, and then round this edge bit, so what we noticed, that his hair now, there's about 1 inch where it's much, much thicker hair from where it was before. So it's going to come in from the edges. It's going to, sorry, that one was a bit sharp. It's going to, where the hair is thickest is where the results seem to be best. So really work around the edges of the thicker hair, and it seems to bring that in. I've been really surprised and really impressed with the results that we have had. And so we were a bit hit and miss as well. We were doing it during lockdown, and we were like, should we do one? And when did we last do one? And we didn't really kind of stick to the routine we should have done. So I think what we're going to do here, we're rather than go weekly, because we're not doing an initial course. This is like a booster course. So we're going to go 2 weekly rather than weekly. And the next one we do is going to be the medical one. I said I would have done it today, but I didn't have the toxin in to do it with. And then I think we're nearly there. And then what happens, if there's any product left, it just gets massaged into the scalp. Just tip your head forward for me a little bit. I need to go right across this edge. This was where we had a really, really good result at the beginning. It was along here. The thin patch, can I get you to just turn there? The bit where there was almost nothing actually extended all the way down to here. So if I grab if I show you here, so you can actually see the line here, and so it was like this all the way down, and this line here has come back almost as thick as the rest of his hairline. So actually it was a really, really good result, and we just want to capitalise on that and keep moving it forwards a little bit. We are nearly there, and I suspect this anaesthetic might be starting to wear off now. We used just a numbing cream to start with. And there's a little dribble left here. So what doesn't go in, I will massage in at the end. So this is a hair restoration mesotherapy serum, hyaluronic acid and a vitamin complex. And this is probably the thinnest bit just here, so I'm going to give that a little bit more with what's left. He's being very brave. He's not swearing at me or anything. The best time to treat somebody would be when they're just starting to thin. So if you're starting to get some receding, you're just starting to notice the patch thinning on the top, that would be the best time to start this process. It would be a really good time to do that, because you're going to get in before you've, it's easier to maintain and to boost what's already there than wait till it recedes right back. I was not expecting the results we've had with Neil, because the point we were at, I was thinking we're just not going to get the results, but we have had an amazing result. So to me, start earlier and get an even better, and stop the hair going to the point where it is as thin as this got. I think that is definitely the way forward. So what I'm doing, I've just popped the last of that product on, and we're just going to massage it in a little bit. How's that? Not too bad?
That's okay.
Not too bad. And so that serum will now absorb into the hair, into the scalp. And that's it. So that is the treatment done. He's now not allowed to do anything with his head for the next ideally he won't be washing his head again. So what day is it today? Friday till Sunday probably. I can help him clean this later with a little bit of a sort of mild skin cleanser, but I don't want him washing his hair or anything like that. So today we're going to do nothing at all to this. And I will be keeping you up to date with the results, and we'll do these lives regularly so you can see the progress and how it's going. And then I would be expecting to see a significant difference in about 6 months' time. So, you know, none of these things are magic, none of these things are, you know, going to change overnight. But the results of this have been so good, and they do last. So we are now nearly 2.5, 3 years down the line, and the results have been quite amazing, actually. I've been really impressed with them. So we'll see how this goes. Like I said, I've taken some pictures. And if you've got any questions, I haven't seen any comments, but if you've got any questions and comments, please do put them on the thread, and I will respond to them. If you wanted to book a consultation, you can do it on the website, and there's no commitment from that consultation to do anything. And if you just want to ask some questions, just ping me a message if you'd rather not put them on the thread. So I said the costings and all like that, because it's quite a complex course and it is only done on subscription. That is all on my website, so it's sallywagstaff.co.uk. Go into treatments, and at the bottom of the treatments menu it says subscription packages, and in there it will give you all of the breakdown of how the hair restoration package works. I said you do need to be committed. I need to see you pretty much weekly. We could stretch it to 10 days if diaries are problematic, but ideally 6 weekly treatments to start with, and then we can drop to monthly. So the first 6 weeks is quite intensive, and then I said it becomes a little bit easier after that. So go and have a look, ask me some questions. I hope that's been interesting, and we will see you again at the next one. See you later. Say bye.
Bye.